A growing number of adults are living with congenital heart disease thanks to a number of medical advances over the past several decades. Continued cardiac care from childhood through adulthood is crucial, yet many young adults put off seeing an adult congenital heart disease cardiologist, which can be dangerous. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. As we continue Heart Month, this week we're talking about the new Kansas City Adult Congenital Heart Disease Program, a collaboration between St. Luke's Mid-America Heart Institute and the Ward Family Heart Center at Children's Mercy Kansas City. With me today is Dr. Anthony Migalski, cardiologist and medical director of St. Luke's Adult Congenital Heart Disease Program, and Dr. Brian Birnbaum, a pediatric cardiologist at Children's Mercy. Thank you both for joining us.
Thank you.
So, Dr. Birnbaum, first, how common is congenital heart disease?
So congenital heart disease affects about 1 in 100 people, and interestingly, about 10% of those are not diagnosed until they're adults.
Okay. And what types of conditions fall under this category?
So congenital heart disease is really any heart problem that somebody was born with. So this can be anything from holes in the heart to valves that are not formed correctly to chambers of the heart that are not formed correctly or really at all.
Now, Dr. Migalski, how has the survival of congenital heart disease improved?
Survival rates have improved dramatically over the past decades, and with this success, many of these children are now living into adulthood, requiring continued follow-up. Somewhat surprising, there are more adults in this country with congenital heart disease than there are children with congenital heart disease, and they require individualized care from a dedicated team of specialists in the area of adult congenital heart disease.
Now, what medical advances have made that improvement possible?
I think two in particular. Cardiac surgery has had huge advances in the past 40 years, such that a lot of these conditions can now be corrected very early in life. The second is catheter-based therapies, where in the past we would have to do open heart surgery maybe a second, third, or fourth time. Now, a lot of these procedures, such as putting a new valve in or closing a hole in the heart, can be done through a catheter from a small incision in the groin or the top of the leg.
So, Dr. Birnbaum, once these children turn 18 and age out of pediatric care, sometimes they put off seeking care with an adult specialist. What are the risks of that gap in care?
Yeah, so, well, as Dr. Migalski was saying, so many of these children and young adults are doing really, really well with the new interventions that are available. What has happened is that as we reach young adulthood, or as these patients reach young adulthood, they don't necessarily feel a need to see their cardiologist or need to see an adult congenital cardiologist. They feel just like any other 18-year-old or 20-year-old feels. And unfortunately, while they may feel great, there's still the possibility of complications arising. Sometimes those complications can worsen over time. And so if we can catch those earlier, it'll help us to intervene earlier and prevent further complications or worsening complications.
Okay. Now, what are some examples of some complications that can worsen over time?
So a great example would be valve disease. So a lot of these children have had valve problems in the past. And while they may feel quite well, their valves can deteriorate and have leakiness or have narrowing. And while they may not feel any symptoms from that, as that worsens, sometimes their heart worsens with it, or sometimes other parts of the heart can worsen with it. So it's very, very important that they have good follow-up.
So Dr. Migalski, can you tell me about the new Kansas City Adult Congenital Heart Disease Program and how it's designed to solve this issue?
Sure. So St. Luke's Mid-America Heart Institute and Children's Mercy Hospital have a long-standing relationship in caring for these patients with adult congenital heart disease. Recently, we launched the Kansas City Adult Congenital Heart Program to formalize that collaboration and to hopefully provide a seamless transition of care from childhood into adulthood.
Great. And what does that process look like?
Well, our goal is to bring the interested parties together, including the patient, their family, their long-standing pediatric cardiologist, along with the new adult cardiologist, so that we all can discuss the patient's condition, their diagnoses, and what to expect moving forward, and have that patient and the family participate in that care so that they have the utmost confidence moving forward.
Great. So last question for both of you. What's the final message you want people to take away from this? Why don't you start, Dr. Birnbaum?
Yeah, so I think it's just important for folks to realize that congenital heart disease is quite common. And there are many times that this is not detected until we're into the adult population. So to be aware of possible symptoms you may be having, and just to recognize that when you have congenital heart disease, it's important to see a specialist within that area. So.
Yeah, similarly, as Dr. Birnbaum said, I think people need to understand that this is a rather unique area of adult cardiology. And so if you or your family member has one of these conditions, you need to seek out and be certain that you can find an accredited program. And as Dr. Birnbaum said, the goal of our adult congenital heart disease program is to make it easy for the patient and their family and for them to feel comfortable with that transition.
Okay, great. Well, thank you both so much for joining us.
Thank you, Lindsay.
To learn more about the Kansas City Adult Congenital Heart Disease Program, visit kcchd.org. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.